Hello, my name is Paul Jevon. I'm the Assistant Director of Nursing for Patient Experience. My role is to support the Trust in implementing the quality goals around patients and carers involved in decisions about their care. Part of this is to enhance the feedback that we receive from all our patients, and the Tell Us campaign is part of that.
Since the campaign was launched, around 12,000 people are contacting us every quarter. That's a 40% increase compared to our position last year. This is because we've introduced a host of ways as part of the campaign in which people can contact us. Tell Us leaflets are distributed around our hospital sites and issued with all new admission letters. We have a team of listeners who interview patients on wards and in outpatient areas on a daily basis. We have a patient panel that's made up of patient representatives from different clinical areas, a patient stories programme where we use visual experiences to enhance learning with staff, not to mention a whole host of quantitative surveys our team coordinates both on and off site. And we ensure that all of this feedback is well publicised around our trust sites so people can see how speaking up is making a difference to both their care and treatment.
Well, the listener's role I'm doing at the moment is so important because I think the patients feel that there's someone they can talk to who can perhaps help them in their little problems. Any complaints they have, any worries, that we can pass it on to the necessary people. One gentleman who was a Jewish gentleman, he didn't know how he could get a rabbi. Then we have looked into it. Things like that, very important to them, very, very important, and I think makes it all worthwhile.
And I spent quite a while chatting to a gentleman on Ward 26 who he doesn't get any visitors at all, so he's just pleased to have somebody to talk to in general, which sometimes you go away from the survey, you're just there for them.
Sometimes if you don't see a uniform, people open up a little bit more to somebody like ourselves.
The leaflet is very self-explanatory. If you go along with what it says, you will have no further problems or any problems within your stay in hospital. Like the other night I asked for blankets and it was brought immediately and access to the bed. Nothing's too much trouble. As I say, it's fantastic, absolutely brilliant. And your family and friends things on the door, yes, you would recommend the place.
Patient feedback is important, both positive and negative, as it allows us to make improvements within the ward.
If you're asked about your patient experience, do please cooperate, because that's the only way that the hospital can know whether it's fulfilling the whole of its function. It can count whether it's fulfilling its medical function, but as to whether it's a decent experience that helps with the healing process, tell them. If you've a complaint, deal with it. If it's been a marvellous experience, tell somebody, so that the hospital can build on its strengths and build up its weaknesses to a point where they're not weaknesses anymore.